Glancy opened its doors in October of 1988 under the leadership of SUNIL, our current medical director. He approached the administration and proposed the idea of serving the inpatient rehab needs of our community and got that support, and he's still here with us today.
Dr. BHOLE, I mean, he's been there obviously since the very beginning. I characterized it that we opened that rehab center with two green people. He was green as a physiatrist coming in, and I was green as an administrator. We started out and we didn't have glitz and glitter. We had an older building that we came in and we remodeled, and we were really competing against Emory and North Fulton. And so we said, we're not going to have that glitz and glitter, but we're going to beat them on quality and outcome. And we have.
I started here at Glancy back in 1988. My role is I serve as the attending physician of the entire rehab team. So all the patients that are admitted to Glancy Rehab Center are admitted to my service.
The fact that it's been 30 years to me is amazing. I mean, I just turn around, if I look at it and say it's been 30 years, that means I got older. I don't know when that happened.
We work well together as a team. We coordinate well together, and eventually that reflects in excellent patient outcomes.
Glancy has been around for a long time. It really feels like a family here. A lot of our therapists and our other staff have been here for over 20 years.
As a therapist, my favorite part is always when the patients come back to visit us. Just walking in, giving us big hugs. That just makes my day.
My husband was Floyd PERALA. At the time, they only had 11 beds here, so he was in one of the 11. He was completely paralyzed on his left side, and they were able to get him up and moving the very next day. He walked out of here with a cane, so he came a long ways while he was here. But he got so good that we had a 37-foot motorhome with a Bronco 2 behind it, and he was able to travel. We traveled pretty much over the United States with that after his stroke. My husband thought that Joan Glancy was just the best place there was. We took classes to be peer visitors so we could visit patients. I think every rehab person that he worked with, he thought were great. I just think that Glancy is the best rehab place in the whole country.
My story is unique. I actually worked here in '95 to 2000, scanned patients in the rehab setting and the emergency room setting. And so it's interesting that in 2008 when I came in for my stroke, and then I was suddenly a patient. I was no longer the caregiver. The staff was very positive and encouraging during the whole journey. The staff was great with my family, warning them kind of what's to come and what to look out for. I recovered very quickly and had excellent treatment and very encouraging, so I think that I was fortunate to be here.
I had a fall down 7 or 8 steps. I was in ICU, totally out of it for 6 or 7 weeks. My experience has just been tremendous. It has risen my personal belief in myself. There can't be any place better than Joan Glancy Rehab. And I really appreciate everyone that was here, and my time spent with staff and nurses and everyone just made my life in 2 weeks a remarkable turnaround.
I would definitely bring my family member here for recovery if they ever need it. I feel very confident of the care that we provide here. So if they ever need to be somewhere for recovery, it's Glancy for sure.